Eigen speaks directly and indirectly on the subject of impact. In a wonderful and dramatic chapter called From Attraction to Meditation, it appears in his book Psychic Deadness, Eigen meets a super intelligent and sensitive patient named Marion. And there is a very strong connection between them from the beginning. Eigen explained that beyond everything that happened in the first session, a feeling of sinking hit him. He writes, "The main thing was that I kept sinking. I sank into myself, past Marion's intellectual overtures. I sank into the pain I felt when she spoke to me, when I looked at her." The theme of sinking is an example of impact, that is, beyond the conversation that took place between them, beyond the opinion that Marion shared, perhaps beyond the opinion that Eigen had of her. Some subtle feeling, not yet formulated, of sinking impacted him, and he allowed himself to be impacted. It is not something that you cancel and put aside saying, it is not relevant to the session. I have to be focused on the session, focused on what Marion says. On the contrary, according to Eigen, paying attention to what is happening to you at a subtle, not yet formulated level takes priority during the session. In another therapeutic moment, Eigen writes that Marion told him, "I'm depressed. I want to kill myself." I felt her words sink into me like depth charges. My vision blurred. It occurred to me that it was important for me not to see her. She was showing me something I was not supposed to see. Her face was menacing. Marion's horror and menace washed through me. When I came back, her face softened. I think she was surprised at the impact she had on me. Again, Eigen allowed himself to be impacted at the most primal level by what the patient said. In this chapter, Eigen also talks about the opposite impact. He expresses the ways in which his personality, being himself, impacts Marion. One of the things he writes about is related to what she calls his healthy indifference. He writes, "Perhaps Marion was attracted to me because I was further along in accepting my offbeat sensibility and in learning to use it less destructively." A few sessions ago, Marion commented on what she called my healthy indifference. She felt my minute attention to nuances, yet she could see that my own life ticked on, that my lifeline was not deflected by hers. I could pay attention to her and then drop her and let her go. It irritated, enraged, and depressed her. It also made her breathe easier. In this therapeutic encounter, there are two people with elevated, unconventional sensitivity. But Marion cannot make the sensitivity work for her. She becomes destructive, and something in the nonverbal encounter helps her to develop other options to deal with her own sensitivity. Just by the fact that she sees how Eigen deals with his sensitivity. So this main theme related to impact helps on different levels. It helps the patient feel that someone really takes in the things that he himself cannot deal with, and someone begins to do a certain action on them, even if it is not an action that can be given a formulated name. Impact is also something that weaves in and influences the treatment in other ways. For example, it serves as an infrastructure for the therapist's intuition, like an ambient vibration that helps you conceive what we call the selected fact, Bion's selected fact. If you're faithful to the power of impact, at some point the fruit of the faithfulness will begin to emerge, and part of the fruit will be certain insights such as the selected facts related to the patient. I want to read a few paragraphs from Eigen about impact. The analyst's primary processor works over the patient's affective impact so that this impact begins to be metabolized. The analyst's processing of the patient's impact is multidimensional and conveys many messages. For example, it gives the patient a sense of being taken seriously. More deeply, the patient experiences, if initially through the analyst, the possibility of someone processing what could not be processed. The patient learns that he is not entirely undigestible, nor entirely digestible, and that partial transformational movement is possible and necessary. This movement goes on bottom-up as well as top-down and involves the evolution of the deep processor, not only upper story functions. Without the growth of unconscious processing ability, upper story changes feel shallow and narrow, even beside the point. The analyst is not only an auxiliary ego for the patient, but an auxiliary deep processor, including an auxiliary primary processor for a time. That is to say, Eigen goes beneath cognitive theories that only try to modify the upper story, the conscious processes, and thought processes. He said that in order to generate a deeper change and get closer to what Bion termed transformations in O, therapists permit themselves to be impacted on a deeper level and lend their primary processing in favor of the patient. It is not a conscious work. It is not a known work. It is a primary and unconscious work that requires faith. According to Eigen, what begins to be metabolized within the therapist is then transferred to the patient, giving them a nonverbal message that their unmanageable experiences can be digested and handled. In this sense, in the context of dreaming, Eigen and Ogden are very similar. Both talk about the therapist lending their dreaming function, the primary processing function, in favor of the patient. The therapist's dreaming helps the patients to dream the dream that so far they could not have even begun to dream.